Welcome to the Startup Grind.
Our featured guest tonight is a pretty cool guy. He's different than a lot of the entrepreneurs that I have interviewed before, and I almost wanted to say he's smarter, but that wouldn't come out right because it's not that. He is a physician, he's an MD, and so he has had a different path to entrepreneurship than a lot of people take. And it's really interesting to me to see the innovation that we can draw from experts in every field, but above that, the people that step out and take on this wild, crazy project of trying to create that innovation in an area that they have expertise, because they don't not only have to be an expert in what they're doing, but then also have to learn this crazy ride of entrepreneurship and building a product or a company. So get up on your feet and join me in welcoming Paul Gilbert. Come on over. All right. So here at Startup Grind, we like to take a minute to get to know a little bit about the person behind the actual startup or product. And so we're going to start talking about Paul for a few minutes here. So tell us about your early life, where you grew up, a little bit about your family or the culture that you grew up in.
All right. Hello? Okay, there. I grew up in Grand Rapids, Michigan. Michigan area, and my mom is a nurse. My dad is a gastroenterologist. So I would say I came from a very medical family. We talked a lot about cardiac arrests or, somebody spitting up on them and all kinds of medical, things throughout my childhood. Dad coming home with blood on his, clothes and
wow.
Very medical, I guess, oriented. Talked a lot about it. I went to college in Indiana, small college in Indiana. Then I finished my training at the University of Illinois in Chicago and was an ER physician in Chicago for 10 years.
Okay. So ER in Chicago, that had to have been a little bit fun.
Yep. Fun is one of the words, I guess. Yeah.
Sure.
Yeah.
So when did you have any early signs of entrepreneurship in kind of problem solving with the things that you were around, or was it really kind of situational as you came upon the problem that you ended up solving?
I've been asked it before and I tried to think about it, but problem solving I think is definitely one of the things I do, and I can recognize in myself young. Making money from it is a totally different thing. And I don't think I was I was not formally business trained as a lot of probably startup people are.
You were kind of busy.
And you're focused on the prize, getting into medical school and then finishing medical school and then getting into the right residency. So there wasn't a lot of time to learn business, entrepreneurial, legal issues, intellectual property, and some people think of purchase order, I think of by mouth PO, or there's still
right.
Very medically minded, I think, and it's been after I've been out there working that I've had to learn the business side.
Okay. So tell us a little bit about the situations that brought you toward the problem that you wanted to solve, and then we'll talk a little bit about what your product is and what your company is now.
Well, I think there was a problem soon after residency. So I was maybe out, I think, for 1 year out of residency. So a tube that goes in the stomach, I guess I have to kind of talk about it if I talk about the problem. Tubes that go in your stomach, if you can't feed yourself, or if you're an infant, you can't feed yourself, or if you have an overdose or bowel obstruction, they have to put tubes in your stomach. And an ER physician, we'll put them in if you come in as an overdose. So everybody hates this procedure. It's like the worst thing.
It sounds pretty terrible.
Yeah, it's you either go in the nose or through the mouth, and when they're conscious a lot of times, and gagging.
Pushing a line all the way.
I've gotten kicked literally while putting in one of these tubes, and it's an accepted. That's a horrible procedure in medicine, and it's been for a very long time. So my dad is a gastroenterologist, as I stated, and this problem kind of plays into both of our specialties. And so very early in my career, I had a patient there was a 21-year-old girl who came in, Tylenol overdose, and you've heard of getting your stomach pumped, right? So put the tube in to pump their stomach, and it went in her lungs instead of her stomach. And the nurse thought that she was in the stomach and ended up filling her lungs with medication, or this activated charcoal. And that, we were like, wow, that's a patient in my ER that ended up in the ICU for a month. And then within 6 months of that period, I had another patient, same type of tube, curled up on the back of the sinuses, and caused the laceration. The patient bled, and the patient was on Coumadin. So I don't know if you know what Coumadin is. It's a blood thinner. So very traumatic, blood everywhere. And I had to stop the bleeding. We were able to stop the bleeding in the ER, and then admitted the patient, tried to reverse the medication, and then later that night, started bleeding again and bled to death. So 2 patients, 6-month period of time. Everybody talks about this horrific procedure. There's really been no, improvement since the 60s. You ram a tube home and take an X-ray to see if you're there after the procedure. So my dad and I just basically started talking about it, and we started thinking about it, and that's really what this company grew out of.
So what was the first iteration of the product?
So this is quite a while ago, and our first reiteration of the product was kind of it's a guide device that the patient would swallow into place. It's like a guide wire that you put the tube over. And we prototyped it, raised money within, friends and family type thing, and prototype worked. And I'm like, all right, good, I'm done, right? So where's the money? We got to figure it out. It's solved, done. And that's when
turns out there's all these regulations.
Yeah,
and
there's this
shit.
thing in the FDA that so the real buzzkill. So
I would imagine that to be the case.
I thought we were there. So that was the first reiteration.
Okay.
And we had a product, and we had it usable, and we had videos of it being used, and I showed all kinds of studies in which it was necessary. And then people with business minds looked at it and tried to figure it out. We started talking to some big companies, and they said, well, it's going to cost this amount to make, and the market size isn't really this big. It's actually, this big. And because you have to be a conscious adult that's cooperative, going to swallow it in place. Majority of these tubes are not getting put in conscious adults that are cooperative.
Right.
So that's where the kind of the rubber hit the road. And on our third patent that we applied for, as an afterthought, we said, you know what, just to make absolutely certain that this tube is not in the lungs or in the esophagus or curled up in the sinuses, let's have an extra just for sure check. And we thought about stomach acid, because your stomach produces stomach acid. It's the only place in your body that produces stomach acid. So there was a lot of studies that were coming out saying that may be a good way to check to see if these tubes are in the stomach. So as an afterthought on our third patent, we tagged on this addition to the kit that was a pH indicator that was enclosed and encapsulated. I guess I can pull it out right now.
Let's do it. Show them what it looks like.
So this is, so it fits on the end. This is an infant tube, and it fits on the end of the tube. And there's a syringe on one of it, and so you pull fluid up from the end of the tube. And if it's acidic, it turns this indicator a certain color. And if it's a low acidity, then you're in the stomach. And it's not a complex solution. This isn't rocket science. It's not an implantable defibrillator. But, so it was a simple solution. And then, the market size for this now, because you're not only talking about that initial insertion, you're talking about re-verification and checking again. Has it moved? Did it go back up in the esophagus? Gets really big. And you can make it after many attempts of trying to make it. it doesn't cost that much to make, and it fits better in a value proposition than our initial product. So that's how we fumbled across that.
And as you've kind of further defined your target market, you have zoned in on saving babies, as you're known for around town.
Right.
So tell us about why that market as opposed to some other ones, or why that one was the most natural.
Again, it comes down to, I'm an ER physician, so I didn't know there was a world outside of the ER, what a lot of it comes down to. So I thought that, man, this is a great solution in the emergency department. But there's not a lot of tubes placed in the emergency department. And when we got out into the market, we even have a reimbursement code in the ER. Babies, and there's a lot of infants that are on feeding tubes, and there's more and more premature babies that are being born. And they put these tubes in, and babies can't talk. When
Is that the problem you're going to take on next?
Yeah, making them talk, yeah. That would be great. Hey, it's in the wrong spot. And that's the name of the device, is the right spot, pH indicator. So it looks like that's really where the market is taking off. Now, we had a bit of good luck in that there are medications that raise the pH of your stomach. So everybody's had Tums or antacids, right? So those medications are given a lot in hospitals to avoid ulcers. So when we got this device out there, we thought ICU is going to be great, the adult population is going to be great, but in the United States, they use these medicines a lot. So it inhibited how useful it was in the adult population. We didn't launch, we didn't have a product for the infants that was FDA approved until much later. And right about this time, they found out that these medications that raise the acidity of the stomach, that kills babies because they have bacterial overgrowth, and they have something called necrotizing enterocolitis, or NEC, so they call it. So right about the same time, we were coming out with a pH device. All the neonatologists were removing this medication that raises the pH of babies' stomachs. So now there's a wide open door for using pH. That was never there before. So how come nobody thought of this before in babies? Because for many years, they were dumping this medication on them, and then they finally said, oh no, that's the wrong thing to do. And we were able to, our first published neonatal study was done here at Banner, formerly Good Samaritan Hospital, in the NICU. Dr. Martin, they did an excellent job at data collection, and they showed that premature babies produce stomach acid. Nobody really knew this. And you can use that acidity to place these tubes. And that's where that was just published last fall.
That's so fascinating. I feel like it's a good example of two things that we see a lot when people are building companies or products. Is the first one being that you do a lot of, I guess the cliche word is pivots, but you do a lot of kind of refinements as you go, because you try something that makes sense and you feel like there's the market for, but then there's a lot of course corrects along the way, and you have to be receptive to those. But then the other half of it is that then, I mean, at the moment that they needed that replacement in the neonatal, you guys already had made it all the way through product development. And so that's kind of a cool, right place, right time story that you were able to provide that for them. Very cool.
Yeah, it was a good time for it, but also it was a willingness to change
That's true,
and to adapt. And a lot of physicians, I don't know, do real well at that, because of course their way is the right way, of course.
It should be, right?
So they know, and so I think that was the willingness to swallow, your pride and say, you're right, this is not what I thought, the way that we should go for marketing, or we should go this way, or maybe this use is better than what I had originally anticipated it for.
Right. Yeah, that can be hard. Okay, so let's talk a little bit about manufacturing. So being a product-based company, what have you learned over time with manufacturing? What were some of your early experiences? How did you make it through that world?
Yeah, so we're not a software company, so that's unique, and we make widgets, so that's unique. And there's not a lot of medical device widget makers that are startups because of the amount of money it costs to product develop things. And it did cost a lot of money to develop it, and I have a board, I told you about this, a plaque of all the reiterations of the product. And our first product that we thought we had it nailed on was we shipped to our initial distributor. They pulled it out and they were videoing how to use it, and it didn't change color.
Oh.
And we're like, what's going on there? So we had last minute changed the type of glue, and the type of glue off-gassed slowly, and we didn't catch it in our accelerated age studies, and it deactivated the pH indicator. So multiple reiterations and attempts, and our initial manufacturer was in Mexico. And so here's another unique part of our company, is that we moved manufacturing from Mexico to Arizona, the United States, and we actually dropped the cost quite a bit.
Wow, that's fascinating.
Due to engineering and robotics and automation. And so with that, it's another good story behind it.
Tell us a little bit about anything that you wish someone had told you before you had to do what you did to get to this point.
Yeah, it's a balancing act between putting money into protecting your product and then making a good product. And you have to do both. At the very initial stages, we got into a little bit of, with the first product, we started to shop it around to big companies before patent approval, and had kind of a bad experience, and then really put our face down. Didn't talk to anybody big, and didn't want to, and just kind of kept to ourselves in developing our own intellectual property, our own product development. And as I said, this was a tag-on device, and we really didn't have good patent coverage for this product until last fall. And then last fall, we received a very nice broad patent from the US government, and then recently in February, we received one in Europe. So that is really easy to say, and all the details and getting there, I could probably spend the whole night on, but it's something that has to be done, costs a lot of money to do, and you don't want to spend all your money, trying to protect your product, because you have to have money left to make the product. So it's definitely a delicate balance, and it's been, if I would have the money back now, I would not have spent money in this part, or, but hindsight is, totally different. So
what about getting medical approvals and stuff? I mean, where is it that you found the most challenges, or what advice would you give someone as they are they have an idea or an invention and they're looking up at that world and trying to navigate where to even start with those processes? Do you get a consultant to help? How do you even approach figuring out what all of the requirements are?
Yeah, I think, initially you have to look at patentability. We're talking about regulation, I guess, off of patentability. So you want to talk about regulation. And whenever, you get into medical or medical devices, everybody, the FDA regulation. So it's a big hurdle, and it's a place where a lot of ideas stop. The way I dealt with the FDA was I hired a consultant who worked for the FDA before, and she gave me kind of a wet read. So called up some people that she knew in the FDA and said, how would the FDA categorize this device? Because we're a lab test, but we're being used as a medical device with a class 2 device, because feeding tubes are a class 2 device. So if you have a class 2 device, that's a lot more regulation than just a point of care lab test. So I didn't know, how the FDA was going to look at that. One pathway is a mountain of work and clinical studies and money, and the other way is much easier. So we got to go down the easy way, the inexpensive way, but it was all based on the claims, what we claimed the product could do. So I can't promise you that I'm going to save cancer in my claims because I can't save cancer.
Or make babies talk.
Or make babies talk,
Got it.
or anything amazing that the device cannot do. So we had to say, and you had to prove it. So whatever you're going to say, you have to prove.
That's
and
great.
you have to prove to the FDA. So we limited what we said so that it was easy to get through the FDA. And then the FDA will monitor you afterwards. So they weren't a big obstacle. And I remember having conversations with them directly in the back of the ER about it and what they thought and what we could say and what we couldn't say and why. And, the FDA, I think they're there to protect the public, but part of protecting the public is bringing products that protect the public. So it's
Yeah.
not all bad.
Makes sense. So it sounds like you guys iterated quite a bit for various reasons. So do you think that the principles of lean and like lean startup apply? Because it seems like a lot of the scientific or medical-based startups, if you will, tend to feel like it can't apply to them because they just can't change that fast.
Yeah, it's harder, but yes, we have kept it very, as far as a medical device company, extremely lean and nimble, small staff, few employees, more consultants, able to change up. And the amount of money that you look at that we spent with 3 published studies and 1 international editorial and 3 FDA-approved products, the amount of money that we spent versus a venture capitalist based or a huge, company, we're very small in the amount of money that we spent to get there because we had to be. If we didn't want to go VC, a lot of money route, which we were able to avoid.
Very
Yes,
cool.
it's very important to stay lean. And I like the Lean Startup. That was a great book. We talked about that. It's hard to do. And it's hard to stay lean. But yes, I think that's a must for any startup. I mean, you absolutely have to.
So what stage are you in now? Tell us about the company today.
The company today is really in a commercialization stage. And the way you commercialize, really, I keep talking about medical devices, but I think it's really any medical or any product is you have to show a value and a financial value. So the trials that we're involved in now are implement, track certain financial metrics, and show a benefit. Different than this is what the product can do, because we've already published studies that show the product can be used for this. Now it's what monetary benefit or decreased complication benefit are we going to give the hospital so they'll spend money on us? And that's kind of where we've gone with it right now.
Wow. Another hurdle, huh?
Yeah, that's going to be another one.
Okay, so and then what do you see ahead as you move into commercialization? I mean, do you think this is kind of the last barrier, and then you'll be able to really start manufacturing and really getting this out there?
Yeah, I mean, we're making it now, and we've had sales, and some of the revenue that we've had in initially was from our distributor to help us develop the product for exclusivity. We've had, with this product, we've manufactured 20,000 of the devices. Most of those were used for a lot of trials and sampling, and we do have sales. We also have had international sales. We have the CE mark. So we are in a stage now, I think, where it's a real product, and we're out there. And
Exciting.
Yeah, so that's kind of the next stage.
Okay. So recently, you were one of the top 4 in Venture Madness. Anybody here? Let's see. Should I say who does not know what Venture Madness is? Raise your hand. Okay, good. Well, okay, so one. It's okay. Brave soul, brave soul. Good. So Venture Madness is a competition here in the Phoenix area for startups, actually from the Southwest. They compete against each other bracket style, and Randy blows a whistle a lot, right? That's basically what happens there.
It's what I do.
It's what he does, yep. So you placed in the top 4 in that. So tell us a little bit about what that was like and what you think contributed to your success there, besides obviously having an awesome product?
Well, Venture Madness is kind of in the, it's in the category of other networking events, within the Valley. There are other ones as well. There's a Venture Ready program, the Arizona Commerce Authority. If you go on that website, there's other events. The Arizona Innovation Challenge is another one. And
did you guys win that too?
We did win that last year, which
Congrats.
is great and
It's a big deal.
capital, non-dilutive, that goes
A
in.
whole bunch, like 250,000 bunch.
Yes.
Really cool
Yes.
program that state has.
And that's, it's state money. You have to sign your life away. No, you don't have to sign it, but you do have to be, you're going to create Arizona jobs, because you're getting, Arizona taxpayer money. But it's a great feather in your cap when you go out to raise money. So I would definitely recommend that, as well as Venture Madness. And there's other free avenues that are out there to network, to get information. And I looked at Venture Madness as kind of a CEO boot camp, where they made you, 3-minute presentation, then a 6-minute presentation, then a 9-minute presentation with people asking you questions afterwards. So it was definitely I'm not very, I wasn't used to talking to a non-medical audience, and it made me really change things up, and I would recommend it. There's no reason not to. And it really helps you change your pitch and make it for the broader audience.
Very cool. Yeah, it is kind of amazing how many resources we have around here. Now, Venture Ready is one that I think people know a little bit less about. Will you tell us a little bit about that one?
Yeah, that's through the Arizona Commerce Authority as well, and it is a program that they put you through different stages, and they'll have other people within the community that are trying to give back to kind of the business startup ecosystem, and they will listen to your pitch and rip you apart. No, they give you
help you, right?
They help you. No, and they give you advice, and there's a lot of attorneys and business owners and CFOs, people that are on hospital boards. I mean, this is like, I don't know how much money that would cost me to get out if I was paying for that advice, but they give it to you freely. So I thought that was great. It's been a good. I've learned a lot from it, and so there are free avenues that don't cost money that you can tap into, and also network like this. That should be part of any startup.
Right. Yeah, I think it was last year was a good example. Greg Scoresby, who is with Campus Logic, that won Venture Madness last year, went on to raise a round within 2 months or something like that, because it's part of what you said, the confidence that's shown in you as you go and have success in these competitions, but it's also partly the networking. It's partly getting the attention of these investors and the people that are kind of ready to help surround and move things forward. So. Yep.
Yeah, and it's it definitely helps when you have a need or want to bounce an idea or need something. What do you think about this? Or so. Yeah.
True. Very true. So, any tips for those considering trying to apply for some of those competitions?
For Venture Madness specifically, or
Sure.
I think obviously everybody has to meet an unmet need, but you have to show startups are all high risk, no matter what way you slice it. So it's a high risk endeavor, but people are willing to take high risk if there's a high payoff at the end. So if I'm going to risk on you because you're a high risk, I need to know that there's a big upside. So showing people within these applications that there could be a big upside to take the risk, I think, is probably the best. And spelling that out clearly within your application, that yes, this could be out of the ballpark. It's possible, definitely possible with this solution.
Okay. Be awesome and have a large market. I
Yes.
like it.
Yeah,
Okay. Very good. So do you think now, having kind of done the various things that you've done throughout your career, do you think that there are similar skill sets required for success in the medical field and in entrepreneurship or in building a company? Or do you think it's expanded your skill sets, obviously in some ways, but do you think that there are some parallels there? Do you see the amount of risk that you have to be comfortable with, or the problem solving you have to do? Like, do you see some parallels between the two worlds that you're a part of now, or do you think they're more different?
They are very different in that, you know, one's very protocol based and one is come up with solutions on the fly. So there's very.
Wait, which one's which? You were in the ER, man.
Yeah, the hospital is very protocol based.
Okay, that's what I thought.
And well, the ER, yes, you think on the fly, that's true, but there still is a way that you're supposed to do things,
Yeah.
that you're taught, and that's handed down from, you know, residency director, and you step too far out of that box, and I think I'm going to do this instead.
Yeah, that wouldn't go
I want
over
to try
well.
this drug out of nowhere, you know.
Yeah.
So, yeah, but there are, I think probably the biggest thing that helped is the stick-to-itiveness. Getting through medical school and residency is a 12-year endeavor.
Yeah.
This company started 10 years ago. It's been a long haul, though this product has only been out for 2 years, or a year and a half, FDA approved. But it's been a very long haul. The grind is a great word, and you want to throw it in sometimes, but adapt and changing, I think, was the key.
So what do you think the future is for Paul Gilbert? Do you want to go back to just simply practicing, or have you come to the dark side? What's the future?
I'm not totally sure I like problem solving, and right now I want to change this area of medicine and see this product carry to fruition. I want to see this device and this solution used ubiquitously throughout the world. So that may or may not happen in the, but I'm going to stick to this. Yes, I have other ideas, and I'd like to see other devices spin off of this intellectual property, whatever, but that's where my focus is right now. That's what I think about every day. So I want to stick to this and get this area of medicine fixed.
And then figure it out. Okay.
Then we'll figure it
That's
out.
fair. That's fair. All right. Anything else you'd like to share before we go into a little bonus question round?
Well, I think, yeah, I guess the networking I would want to emphasize,
Okay.
and there's a lot of free avenues to network and to utilize that, I think, and
Why do
it
you
should
think
just be
it's-
part of your schedule.
Why do you think it's so important for people to network? What is it about that that has mattered so much for you?
It's advice, and you can run your ideas by a lot of people's brains, without paying for it, really.
Yeah.
And you can learn something from everybody,
That's true.
maybe a little tweak or, modification or something. So I think the networking piece has been very big, and it's been big for me the last year and a half, where before it wasn't as big.
I like that. That's cool. All right, very good. Thank you. So we're going to do Q&A in just a minute. So if you've got your questions, get ready. But in the meantime, before we do that, we're just going to play a little game of 20 questions to get to know a little bit more about Mr. Gilbert here. So just tell me your initial answer for each one. Here's the first one. Cats or dogs?
Dogs.
Beer or wine?
Wine.
Sushi or tacos?
Sushi.
Not from around here?
Yeah, that's not.
Coke or Pepsi?
Diet Dr. Pepper.
All right, that's fair. Favorite app?
SoundCloud.
Favorite operating system?
I don't own anything Apple.
Aha, all right. Favorite holiday?
New Year's, I guess. New Year's. Time to make resolutions.
Sure. Favorite type of car?
I like my Infinity. I don't know.
Oh, those are
I
really
don't
nice.
really think about
Yeah, I like those. Favorite vacation spot?
St. Martin. Yeah.
Favorite book?
Favorite book. Recently, it's been Good to Great, but I love the classics. I mean, the classic books.
Favorite movie or TV show?
ER. No,
I was
no, I
gonna
did
say.
not like watching ER. I liked watching ER till I actually started working in the hospital, and then I didn't like it anymore. I think TV show. I don't know. I don't watch a lot of TV.
It's okay if you watch Bachelor or something. You can
No,
admit it here. It's a safe place.
There was a one medical show just recently I watched. I can't remember the name of. It was on Showtime, but it was the turn of century medicine in New York, and I thought it was amazing,
interesting.
and it was a lot of historical value. That was very cool.
All right. Favorite musician, artist?
Neil Young, I think, was way back. Yeah,
Hmm.
I used to play some of his songs.
Your go-to karaoke song?
"Hurt" by the Nine Inch Nails when it was redone.
We do have
Real
it.
done by Johnny Cash. I can
Okay.
actually sing that low. I go there.
Okay.
I can go there. Yeah.
I feel like we should get in some more drinks. What do you guys think? All right. Anything you collect?
Bikes. I've got a lot of mountain bikes, not motorcycle bikes.
Okay.
I seem to collect a lot of those because I break them and get another one.
Have you done the whole downhill mountain biking thing?
No, I don't do the downhill.
Oh,
but I do
I don't
mountain bikes.
recommend it.
yes.
I thought we were
heard
gonna like ride down like the trails of like that the cars drive down on the mountains. No.
Yeah, I've heard it's fun. I may know a little too
Maybe.
much working in the ER. But
Yeah, I believe that. Okay. Any unusual skills or talents?
I was originally an art major, so I did a lot of art initially.
Hmm.
Yeah.
What kind of art?
Well, all the mediums, but I did a lot of the pencil, watercolor, oil.
Cool.
Nothing recently because I haven't had any time.
Yeah, I'm sure. What's your top strength in business?
I think that I'm passionate about this specific problem, so I think the passion in solving this and the personal experience that I had with patient death, and that's probably my biggest asset, I think.
I'm sure. What, if you could do it all again, what profession other than your own would you like to attempt?
I've had a lot. The professors and teachers have had a lot of influence on me, so I think I thought that would be a great profession. I think being a professor or teacher or something like that.
That's cool. What is the best compliment someone can give you?
I can relate, or that they can. I guess I can relate. Like you can see that you've communicated with them in a meaningful way. So.
What's a cause you are passionate about?
What cause am I passionate about?
Mm-hmm.
Well, of course, it's
Besides pH.
I think it's changing these things in medicine, these risks that have been accepted for a very long time. So making people within medicine think in new ways to
Okay.
fix old problems.
And last one, what is one thing on your bucket list?
I've never skydived, so that's a great bucket list one. So I want to do that, I think, someday.
Totally works.
It's a great bucket list.
All right. So we're going to take a few questions. Let's see. We don't really have a mic. So I will repeat your question so that we can capture it on the video, and then you can answer, okay? So, yes, Matt.
You mentioned taking your product to the world, and as you know, unfortunately in this country, healthcare is a little complicated, not necessarily the most efficient. Have you had any luck working with healthcare systems in other countries, and how open they are to new technology as far as bringing a new product to market?
So have you noticed a difference between the U.S. and other countries in your ability to get a product to market?
We have not made international a focus. The international sales we have been from people finding us. So we don't have the bandwidth, and I wouldn't begin to say that I know how to launch things internationally. You can hire somebody to do that, but we have had interest, and yes, it is very different. I think internationally there's even more government involved. So it's more of a top-down model. Even more than here. Here it's kind of a system-down model.
Do they have to get approval to use it in their country, or?
It's CE marked, so Europe it can be used.
So
Now,
CE marked, what does that mean?
CE marked is the equivalent of kind of an FDA
Okay, I see.
in Europe.
I see.
But there is specific countries
I see.
approval. So we have had it used. Now there's some other regulations and things that each country wants, so it is a more complex issue. The United States has been our focus by far right now.
Great. Any other questions? Yes.
Medicine is inherently risk averse. And so in introducing new technology, what advice would you give folks who are trying to gain inroads into an environment like that by bringing disruptive technologies or new medical devices?
Advice for getting non-risk loving medical people to get excited about a disruptive product.
Well, the potential of saving complications, I think everybody goes into medicine because they want to save lives. So if, I've run into people like myself who have had a patient die from a misplaced tube or a baby die. And those are big motivators. So we've been able to use that to have other, without really any financial compensation, these people have come out and done studies or trials or gone to value analysis or gone to bat for the product without really paying them more, very small amount to pay for the research. But I think we focused on that because they are risk adverse, so they don't want that. They don't want to be the one who misplaces that tube and does the damage. So we've been able to leverage that, I think, to get people to look at a new way of using it. So that would kind of be my answer. They're still risk adverse, but you can use it
Tell the story.
to your favor.
Yeah. Any other questions? Yes, Mac.
How are you currently distributing the product? Are you going direct to the healthcare system? Or are you working with local independent distributors?
We signed in the United States, we signed an exclusive agreement with a network of independent sales companies. So there's 11 of them that cover the country, and it's an alliance. They're kind of growing with us. They don't, so as, we're not married to them. It's kind of a loose association. They make money. We sell them a transfer price, which also means that they don't make money unless we're selling products. So we have to do the initial sale and the heavy lifting. They're not going to do a lot of the initial work. They make money when they move the boxes. But they are helping, and there's 80 of them across the country. So we've got 80 people talking about our product out there, which really we didn't have to pay them anything to do that. They make money when they make money. So that's how we decided to go in the United States. Internationally, we're selling directly to distributors. We have a agreement in Australia. I think that's the only one. I think we have one in Qatar. Nothing in Europe yet, no agreements yet. They just will buy some and then they go with it. So that's what we've done in the United States.
All right, any others? Oh, okay, Matt, let's do this. Last question.
With the potential to save costs and also reduce risk and therefore reduce the cost of lawsuits, are there alliances to be made also with insurance companies that might be potential allies as far as this kind of work?
Yeah.
I was just talking to Julie here in the front, who tried to sell a product to insurance companies, and I've had that. People have asked me that quite a bit, and I think they're almost harder than hospitals to sell to, but doesn't mean that it's not an avenue. I have not looked at it yet. I've not called up Blue Cross Blue Shield and said, what do you think about doing this? And we have a reimbursement code. So when it's used, now the way reimbursement codes work, I could talk an hour about this. It's not a clear-cut reimbursement. A lot of things are wrapped into diagnosis, not the product. So the insurance companies, I think, will promote it when they see a clear cost savings. And that's what we're trying to show them now. I don't know if they're a call point yet.
Very good. Well, thank you, Paul. We really appreciate you spending your evening with us tonight.
Thank you. Appreciate
Yeah.
you being here.
Awesome.
Thank you.
All right. That's it.
Thank you very much. Appreciate it.